let's talk about your meniscus. So many of you have dealt with meniscus injuries before. Being a physical therapist for over 20 years, I can tell you there are many ways to avoid surgery and have your knee feeling better soon. So let's talk about what your meniscus is. You have two in each knee. You have a medial meniscus, which sits on the inside, a lateral meniscus, which sits on the outside. And basically, in simple terms, it is a cushion between your femur, so your thigh bone, and your lower leg bone, your tibia. So it acts as a cushion, and it sits like almost these little kind of pillows on either side. So when you get an injury, typically what happens is you get a little micro tear in that meniscus, and it goes from the outside edge towards the middle. And what causes you pain and problems is that it starts to fold over time, and it can come and go. So that's why you'll feel kind of that giving way in the knee, or a clicking, or a pain that sometimes seems to be there and sometimes isn't. Or you'll bend it right a lot or sit with it bent, and it's really hard to straighten it back out. So what happens is that flap kind of comes and goes, right? It bends itself over itself, basically. And so what surgery will do is they'll either clip that out and take out the tear completely. Occasionally they'll stitch it back up, but most of the time for a typical person, they're gonna actually cut it out. I have seen varying results over my entire physical therapy career. I've seen varying results with meniscus surgery. So I recommend my clients actually take a lot of time doing exercise first before agreeing to meniscus surgery. Of course, everyone is different. Of course, you'll want to talk to your doctor. But in my honest opinion, you should take at least 6 months minimum after a meniscus injury to do exercises and try to deal with it on your own before you go to surgery. And that's what we're talking about today, is what you can do to avoid surgery. I'm going to give you my 3 top exercises. They're going to seem so simple, but if you do them every single day, it's going to help strengthen and stabilize that knee so that the meniscus doesn't bother you anymore. No, we can't heal it, but we can address it so it doesn't bother you long term, which is what we want. So I'm also going to give links to my other knee videos that are going to help strengthen everything else, because we really want to make sure that we're getting the hips. So go find my other videos for hip strengthening, Pilates for legs. Those kind of things are really going to help. But I'm going to give you the top 3 exercises that I think you should be doing every day to help a meniscus injury. So first off is a quad set. So you're going to sit with the legs straight out in front of you. And we're going to work on the injured leg, but I think it's not a bad idea to do all of these on both legs actually, okay? But we're going to work on the injured leg. So what you'll do is have it straight out in front of you, and you can sit upright like I am, or you can just lean back on your elbows or on your hands. And what you're going to do is pull the toes back towards you as you tighten this thigh muscle, your quad. So I'm tightening it. I'm trying to hold it 10 seconds, and then I'm going to relax. And then I'll do it again. So I'm going to tighten and pull the toes back. That part's important because it actually tells your quad to stay strong. So tighten everything, hold 10 seconds, and relax. Again, it's going to seem simple. I told you, I'm not going to have you do squats, but I want you to do these because what we're really doing is working some really specific parts of that thigh muscle to make sure that it's helping to stabilize the knee, okay? So I'll do one more with you here. At home, I want you to try to do 50 of these a day, all right? So you can do maybe 10 in the morning after you wake up, before you get out of bed, 10 at night before you fall asleep. You can do them throughout the day. You don't have to do them all at once, but try to do at minimum 50 a day. There are some people who are going to tell you to do up to 500. I don't think that that's going to happen for most of us, but if you can do 50, I'll be happy, okay? So that's exercise number 1. Exercise number 2, I am going to go back on my elbows for this one. So what you're going to do is, again, same thing. Tighten that quad, pull the toes back, and then lift the leg up to about a 30 to 40 degree angle and lower it back down. Tighten again. Make sure it stays really tight. Lift slow and lower and release. I don't want you doing this flat on your back. Okay, if you lay flat on your back and do this, it actually becomes a lot of work for the abs, which is not what I'm going for right now. I want to focus on that quad muscle. So either on your elbows, or if you need to, You can like prop a bunch of pillows here and lay on some pillows to do it. But notice I'm keeping my knee totally straight and I'm only lifting it to about that 30 to 40 degree angle. Okay, I don't want it up here. Don't bring it all the way up here. All right, I'll do one more to show you. And on these, you're gonna do about 20 a day. Okay? So that's called a straight leg raise. Again, just nice and slow. Nice job. Okay, last thing you're gonna do, and this one is again gonna seem very simple, but you're gonna take a pillow, and I have a ball. So I have this squishy Pilates ball, but you can just use a pillow at home. Fold it in half, put it between your knees and lay down on your back. All right? And what you're gonna do is squeeze it and hold that 10 seconds. I am not squeezing as hard as I possibly can, right? If I do that, I get into all these other muscles. I'm squeezing with maybe 50% effort, holding it 10 seconds, and I want you to do 20 of these a day. Because what this is doing is working the inner thigh. Really important muscle group to help, again, stabilize that knee, keep it tracking correctly, and help to take pressure off that meniscus. All right? So squeeze, hold at 10 seconds. Again, just about 50% effort. And then relax. So those 3 exercises are gonna help quite a bit as you work towards helping your knee and feeling better and avoiding meniscus surgery. So I'm gonna put a link above to my full length knee video that you can incorporate as well. But if you wanna keep it simple, work on these 3 exercises every day. Leave a comment below. Let me know how you feel, and I will talk to you soon. Thanks so much for stopping by. Remember, subscribe to my channel and you'll be notified every time a new video comes up. Like and comment on this video and let me know what you thought. You could also always come over to jessicavalantpilates.com to find all the resources I have for living a healthy lifestyle, including full-length workout videos, healthy recipes, and a community I would love for you to be a part of. So I'll see you there.